going through ICU rounds, I bet you're going to get pimped on this question. So let me help you in 2 minutes. So you have a patient, they're coming in, they just had surgery, and now they're in the ICU getting managed for a few days until they get better. And the topic of nutrition comes up. And they ask you, are you going to give them their full diet, or are you going to reintroduce TPN slowly, 50% of their, and let's say you say, well, I want to reintroduce it slowly, and they're going to ask you why. Why not give them the full dose? Some of you might know the answer, but I really want to explain it because it gets brought up a lot. This is because you're trying to avoid something called refeeding syndrome. So people that haven't eaten for a while, if it's anorexia nervosa or they've been through surgery, and you give them their full diet, you can cause so much illness in these patients. Why? Because if you give them their full diet, you're going to have this insulin surge, and that causes potassium, phosphorus, magnesium to get tucked into the cells. So you're basically going to have such low electrolytes. Your potassium, phosphorus, and magnesium are going to be low. And that's tragic. Because if they're low, phosphorus specifically, this is the currency of the cells. There's low ATP, right? And if you think about the heart, now it literally cannot pump because there's no phosphorus, there's no mag, there's no potassium. So it can cause patients to have arrhythmias, hypotension. They don't have cardiac contractility, and they can literally end up with V-TAC. Not only that, they can end up with seizures, delirium, diarrhea, vomiting, nausea, all because you have given them their diet all at once. This is why when patients go through surgery or they haven't eaten in a while, like anorexia nervosa patients, when we reintroduce diet, we introduce it slowly so we avoid refeeding syndrome. Check it out.